How do hormones create PCOS symptoms? Imagine your body as a finely tuned orchestra, where hormones are the conductors guiding every note. When the balance shifts, it can create a symphony of symptoms that many women with polycystic ovary syndrome experience. At the heart of these changes are hormonal imbalances involving elevated male hormones, insulin resistance, and disrupted reproductive hormones. These changes interfere with how the ovaries normally function, leading to the characteristic signs of PCOS. One of the main players is androgens, often called male hormones, though women produce them in small amounts. In PCOS, women tend to have higher levels of androgens like testosterone. This excess causes symptoms such as unwanted facial and body hair growth, known as hirsutism, along with acne and thinning hair on the scalp. These hormones also interfere with the development and releases of eggs from the ovaries, which results in irregular or absent periods and ovulation problems. This disruption can make conception more difficult. Another key factor is insulin resistance. Many women with PCOS do not respond properly to insulin, a hormone that helps regulate blood sugar levels. When the body becomes resistant, the pancreas produces more insulin to compensate, leading to high insulin levels or hyperinsulinemia. Elevated insulin stimulates the ovaries to produce even more androgens, worsening hormonal imbalance. This process can also cause weight gain and make it harder to lose weight, which can further intensify PCOS symptoms. Hormonal imbalance also involves other reproductive hormones. Women with PCOS often have higher levels of luteinizing hormone, which signals the ovaries to produce more androgens. Too much luteinizing hormone can impair normal ovulation. Meanwhile, follicle-stimulating hormone levels may be low or normal but are often not enough to help mature the ovarian follicles properly. This leads to the buildup of immature follicles that look like cysts on the ovaries, giving the condition its name. Low progesterone levels are common because ovulation is irregular or absent, which can cause irregular menstrual cycles. Estrogen levels may stay normal or be slightly elevated but are imbalanced relative to other hormones, further disrupting the cycle. These hormonal shifts cause the ovaries to develop many small, immature follicles that do not release eggs regularly. This abnormal follicle development results in the classic polycystic appearance seen on ultrasound and contributes to infertility issues. Additionally, the hormonal imbalance can cause skin changes like dark patches, known as acanthosis nigricans, linked to insulin resistance. Mood swings, fatigue, and sleep disturbances are also common, stemming from the complex interplay of hormonal and metabolic factors. From a fertility perspective, these hormonal imbalances mainly affect ovulation and egg quality, making conception more challenging. Unlike endometriosis, which involves tissue growing outside the uterus and often causes pain, PCOS is primarily a metabolic and hormonal disorder impacting ovarian function and menstrual regularity. Both conditions can coexist and contribute to infertility, but their underlying hormonal mechanisms are quite different. Managing PCOS symptoms often involves lifestyle changes like diet and exercise to improve insulin sensitivity, along with medical treatments aimed at balancing hormones, promoting ovulation, and reducing androgen levels. Always consult healthcare professionals for personalized advice, as each woman's experience with PCOS can vary widely. Understanding how hormones influence these symptoms helps in choosing the right approach to regain balance and improve overall health.